the gut-thyroid axis, a hidden connection. We often think of the thyroid as a standalone gland tucked away in our neck, dictating our metabolism. But this tiny butterfly-shaped organ doesn't work in isolation. Its function is intimately intertwined with the health of our gut. Yes, you read that right. Your gut health directly impacts your thyroid health. Ignoring this crucial connection can lead to misdiagnosis, ineffective treatments, and persistent health issues. This intricate link between the gut and thyroid is what I call the gut-thyroid axis. It's a two-way street where dysfunction in one system can trigger problems in the other. Many people struggling with thyroid symptoms like fatigue, weight gain, and brain fog may actually be grappling with an underlying gut imbalance. This is why it's crucial to look beyond conventional thyroid treatment and address the root cause of these issues. Understanding this connection is the first step towards unlocking true thyroid health. By addressing gut issues, we can often alleviate or even eliminate stubborn thyroid symptoms. This holistic approach focuses on restoring balance within the body rather than simply masking symptoms with medication. It's time to shift our perspective and view the thyroid not as a lone ranger, but as an integral part of a complex and interconnected system. Before we dive into misdiagnosis mayhem, give this video a thumbs up, make sure to subscribe to the channel and hit the notification bell. Are thyroid hormones always the answer? The traditional approach to thyroid health often relies heavily on prescribing thyroid hormones. While this can be life-changing for some, it's not always the complete solution. Many individuals diagnosed with hypothyroidism, for example, may not actually require long-term hormone replacement. Their symptoms could stem from an undiagnosed gut problem that's interfering with thyroid hormone production or conversion. This over-reliance on medication without addressing the root cause can lead to a cycle of dependence and potential side effects. It's like putting a band-aid on a wound without cleaning it properly. You might temporarily cover the problem, but it won't truly heal. This is why it's essential to investigate the gut-thyroid connection before automatically resorting to medication. Taking a step back and exploring potential gut issues can often reveal the underlying culprit behind those frustrating thyroid symptoms. This approach emphasizes identifying the root cause and addressing it naturally, potentially reducing the need for long-term medication. It's about restoring balance and function within the body, allowing it to heal and thrive. Remember, not all thyroid problems are created equal, and a one-size-fits-all approach simply doesn't work. It's time to ditch the band-aid solution and opt for a more holistic approach that considers the intricate connection between our gut and thyroid. The gut's role in thyroid hormone conversion, T4 to T3. To understand the gut-thyroid connection, we need to delve a bit deeper into how thyroid hormones actually work. Our thyroid gland primarily produces thyroxine, commonly known as T4. This hormone is like a precursor, needing conversion into its more active form, triiodothyronine or T3, to exert its metabolic effects throughout the body. This is where our gut comes into play. The majority of T4 to T3 conversion happens in the gut, thanks to the incredible work of our gut microbiome. This bustling community of trillions of bacteria plays a critical role in our overall health, including thyroid function. When our gut microbiome is out of balance, with an overgrowth of harmful bacteria or a lack of beneficial bacteria, this conversion process can be disrupted. This disruption means that even if your thyroid gland is producing enough T4, your body may not be effectively converting it into the active T3 hormone. This can lead to a whole cascade of hypothyroid symptoms even when your TSH levels, a common marker for thyroid function, appear normal. It's a classic case of not seeing the full picture. Therefore, optimizing gut health is crucial for ensuring efficient T4 to T3 conversion and ultimately healthy thyroid function. This means fostering a thriving gut microbiome through diet, lifestyle changes, and targeted interventions when needed. Beyond TSH, the problem with incomplete thyroid testing. When it comes to diagnosing thyroid disorders, TSH, or thyroid-stimulating hormone, levels are often the go-to marker. While TSH testing is important, relying solely on it can be misleading and result in inaccurate diagnoses. TSH is like a messenger hormone produced by the pituitary gland to signal the thyroid to make more or less hormone. However, it doesn't tell us the whole story. Firstly, TSH levels can fluctuate throughout the day and are influenced by various factors like stress, medications, and even the time of day you take the test. This means a single TSH reading may not accurately reflect your overall thyroid function. Secondly, and most importantly, TSH testing doesn't provide information about the actual levels of circulating thyroid hormones, T4 and T3, in your bloodstream. To get a complete picture of your thyroid health, it's crucial to go beyond TSH and request a full thyroid panel. This includes testing for free T4, free T3, and reverse T3, along with TSH. This comprehensive approach provides valuable insights into your thyroid's hormone production, conversion, and activity levels. Remember, treating thyroid disorders based solely on TSH levels is like trying to navigate a maze with only half the map. It's essential to advocate for your health and request a complete thyroid panel to ensure you're receiving the most accurate diagnosis and personalized treatment plan. Could you be misdiagnosed? Recognizing the signs, given the complexities of thyroid function and the limitations of standard testing, misdiagnosis of thyroid disorders is more common than you might think. Many individuals struggling with persistent symptoms like fatigue, weight gain, brain fog, and constipation may be misdiagnosed or undertreated for hypothyroidism. If you've been diagnosed with a thyroid disorder but haven't experienced significant improvement with medication or continue to experience symptoms, it's crucial to explore the possibility of misdiagnosis. This is especially important if you haven't had your free T3 and free T4 levels checked. Other signs that warrant further investigation include experiencing gut issues like bloating, constipation, diarrhea, or diagnosed gut conditions like irritable bowel syndrome. Since gut health significantly impacts thyroid hormone conversion, these digestive problems can be a major clue that your gut might be the root cause of your thyroid woes. Don't ignore persistent symptoms or dismiss them as something you have to live with. Advocate for your health, seek a second opinion if needed, and request a comprehensive thyroid panel to ensure you're receiving the most appropriate care. Stress, nutrition, and their impact on thyroid function. While the gut-thyroid connection is crucial, it's not the only factor affecting your thyroid health. Chronic stress and nutritional deficiencies can also significantly impact your thyroid function, particularly your T3 levels. When we're under stress, our body produces cortisol, the stress hormone. While cortisol is essential for survival, chronically elevated levels can interfere with T4 to T3 conversion, leading to lower active thyroid hormone in your system. Similarly, nutritional deficiencies can wreak havoc on your thyroid. Nutrients like selenium, zinc, iron, and iodine are essential for healthy thyroid hormone production and function. Deficiencies in these nutrients, which are unfortunately common, can contribute to hypothyroidism and exacerbate existing thyroid problems. Addressing these lifestyle factors is crucial for optimizing your thyroid health. This includes implementing stress management techniques like mindfulness, yoga, or meditation, and ensuring you're consuming a nutrient-dense diet rich in whole foods. Testing for nutrient deficiencies and supplementing appropriately can also be incredibly beneficial in restoring thyroid balance. Reclaiming thyroid health, a holistic approach. Now that we've delved into the complexities of thyroid function and the various factors that can disrupt it, let's explore practical solutions for reclaiming your thyroid health. A holistic approach that addresses the gut-thyroid connection, manages stress, optimizes nutrition, and considers targeted interventions is key. Firstly, supporting your gut health is paramount. This includes consuming a gut-friendly diet rich in fiber, prebiotics, and probiotics, reducing or eliminating inflammatory foods like sugar, processed foods, and unhealthy fats, and managing stress levels. Additionally, specific supplements like probiotics, digestive enzymes, and L-glutamine can be beneficial in restoring gut balance and improving thyroid hormone conversion. Secondly, balancing your hormones is crucial. This involves managing stress through lifestyle modifications and potentially incorporating adaptogenic herbs like ashwagandha or rhodiola. Testing your hormone levels and addressing any imbalances with the help of a qualified healthcare professional is also essential. Thirdly, ensuring adequate intake of thyroid-supporting nutrients is vital. This includes consuming selenium-rich foods like Brazil nuts, zinc-rich foods like pumpkin seeds, and obtaining sufficient iodine through iodized salt or seaweed. Testing for deficiencies and supplementing appropriately under the guidance of a healthcare provider can also be beneficial. Finally, emerging therapies like red light therapy show promise in supporting thyroid function. Red light therapy works by stimulating cellular energy production and reducing inflammation, which can be beneficial for thyroid health. Remember, reclaiming your thyroid health is a journey, not a quick fix. It requires a multifaceted approach that addresses the root cause of your thyroid imbalances rather than just masking the symptoms. Unmasking the culprit TPO antibodies and thyroid dysfunction. In some cases, thyroid dysfunction isn't just about gut health, stress, or nutrient deficiencies. It can stem from an autoimmune condition called Hashimoto's thyroiditis. In Hashimoto's, your immune system mistakenly attacks your thyroid gland, leading to inflammation and impaired hormone production. One of the key indicators of Hashimoto's is the presence of thyroid peroxidase antibodies, or TPO antibodies, in your blood. These antibodies specifically target thyroid peroxidase, an enzyme crucial for thyroid hormone production. Elevated TPO antibodies indicate an autoimmune attack on your thyroid gland. Testing for TPO antibodies is essential for anyone experiencing thyroid symptoms, especially if other causes have been ruled out. If you test positive for TPO antibodies, it means you have Hashimoto's thyroiditis and require a different approach to manage your condition. Treating Hashimoto's goes beyond simply supplementing with thyroid hormones. It involves addressing the underlying autoimmune attack by reducing inflammation, modulating the immune system, and healing the gut. This often requires a multi-pronged approach involving dietary changes, stress management, and targeted supplements. The gut's influence on thyroid medication effectiveness. For individuals with hypothyroidism who require thyroid hormone replacement therapy, the gut plays a crucial role in medication absorption and efficacy. Just like with food and nutrients, the gut is responsible for absorbing thyroid medications and transporting them into the bloodstream. When gut health is compromised, it can impair medication absorption, leading to suboptimal treatment outcomes. This means even if you're taking the prescribed dosage of thyroid medication, your body may not be effectively absorbing and utilizing it due to underlying gut issues. This is why addressing gut health is crucial even if you're on thyroid medication. By optimizing your gut microbiome and improving gut function, you can enhance medication absorption and potentially reduce the dosage required to manage your symptoms effectively. This can lead to better symptom control and potentially minimize the risk of side effects associated with higher medication doses. Remember, thyroid medication is just one piece of the puzzle. Addressing gut health is essential for maximizing medication effectiveness and achieving optimal thyroid balance. Advocating for your health. Questions for your doctor. Navigating the complexities of thyroid health can feel overwhelming, but remember, you're your own best advocate. Don't hesitate to ask your doctor questions, request specific tests, and seek second opinions if needed. Here are some essential questions to ask your healthcare provider. Can I get a full thyroid panel, including free T4, free T3, reverse T3, and TPO antibodies, in addition to TSH? Could my symptoms be related to gut health or nutrient deficiencies? What are my options for testing and addressing gut health issues? Are there any lifestyle modifications or supplements that could support my thyroid health? What are the potential causes of my thyroid condition, and how can we address the root cause? Remember, you have the right to be actively involved in your healthcare decisions. Don't be afraid to advocate for your needs and seek the answers and support you deserve. The future of thyroid care, personalized and integrative. The future of thyroid care lies in personalized and integrative approaches that consider the intricate interplay between the gut, immune system, and other systems within the body. This means moving away from the one-size-fits-all approach and embracing individualized treatment plans tailored to each patient's unique needs. Advancements in genetic testing, microbiome analysis, and functional medicine offer promising avenues for understanding the root causes of thyroid disorders and developing targeted interventions. By identifying genetic predispositions, gut imbalances, and other contributing factors, healthcare providers can create personalized treatment plans that address the underlying drivers of thyroid dysfunction. This integrative approach emphasizes a collaborative partnership between patient and practitioner, focusing on lifestyle modifications, nutritional support, stress management, and targeted interventions like gut healing protocols and immune modulation therapies. It's about treating the whole person, not just the symptoms, to achieve lasting relief and optimal thyroid health. As we continue to unravel the complexities of the thyroid and its intricate connections within the body, we can expect to see even more personalized and effective treatment options emerge. By embracing an integrative and patient-centered approach, we can pave the way for a future where thyroid health is restored and maintained for the long haul.